everyone. So it's really honor to have Ravi Godse with us today. And our association goes back to first MBBS, joining MBBS, and very close friends from the same batch and closely knit.
फेसबुक पे गो लाइव क्यों नहीं आ रहा है पता नहीं चल रहा है नहीं हुआ है
So Dr. Godse, I have seen his struggles. I know how he went to US and he's a successful physician. And now his passion was making movies. And I think he has directed about 6 movies. And he's going to come up with a new one soon, Thursday the 12th. So he always has a great sense of humor, rather wacky at times, and only few might understand what he's trying. But the way he has handled the fears and allayed the misconceptions of the common man is a phenomenon to behold. Uh, you let him walk on the road without a mask and he gets mobbed. We were with him together over the weekend at Bijlani, and we were just amazed that our friend who was just Godia for us is now a celebrity because at every stop, Usacha Gurwad, Bagicha, anywhere we went, people, "Arey, tumhi Dr. Godse and photo with him." So he's really come a long way, and it's not only the humor. What he does is gives you the correct facts also. It's not just fun. So what happens is that it's put in a funny way, but what he talks is genuine and it is researched. So it's not that ahibul. And from that, he gives a perspective which is different from what the authorities are saying. And it's direct because he's under no pressure or obligation from any party or any kind of media house. So it appeals to the heart because we know that there is a lot of confusion with the Omicron and what's happening today. So without much ado, I'll just hand over to Ravi and he can guide us about COVID-19, what's happening and what about Omicron.
Take off the mask.
There was a movie called Jerry Maguire. I know how many of you have seen. There are 2 lines. One is show me the money, and second is you had me at hello. I'm going to show you the money and going to have you guys at hello. There's not going to be a third wave of Omicron in India. Guaranteed. You can take it for sure. Now, I've not really prepared much. I thought it was all question and answer, but just to say a few words, it's like no big deal at all. Sandeep introduced me. Now, it's a tradition that we don't speak highly of each other. He broke the tradition. I'm not going to break it. So, the topic is myths and facts about Omicron. I think it's too soon to give that title. Let's suppose, what is the myth that Dr. Patwardhan is not irritated? What's the fact? He is. But we don't know that. It's too soon, right? With Omicron. I'm not saying he is not. I'm saying we don't know enough right now. So me, Sandeep and Manisha were together right from first MBBS. To tell you the truth, now that we are speaking the truth, I really didn't like Manisha. Because I'm always threatened by people who are smarter than me. And there are so many of them. It's like astounding. But I don't know what to say about Omicron. It might be, I think it would be, this is mostly the physician audience. So we have to be careful because we are the thought leaders in the community. Our relatives, our friends look forward to us. They don't listen to anything we say because they have WhatsApp. But they still ask us like the first opinion. So the big thing is, if Omicron were to explode in India, it would already have. So cases going from 100 to 101 is not news. Miss, come on. I don't know like what has come over us that we are watching that meaningless drivel on media. What are facts actually? These facts can be, they say like a politician or a media person uses statistics like a drunk uses a lamppost, more for support than for elimination. You can take facts and you can just twist them around. I'll give you a simple example. Suppose before the vaccines were developed, the chance of COVID in kids is very low. Chance of serious disease is extremely low. I'm not a pediatrician, but I'm not really no expert. I just say these things. So suppose previously 100 unvaccinated people, adults, 50 were ending up in the hospital, and in kids, suppose 2 were ending up in the hospital. So we would say that the kid hospitalization were 2% and the adult hospitalization were 50%. And the adult hospitalizations were 25 times more than the kid hospitalization. Then the adults get vaccine, and out of 100, we get only 10 hospitalizations due to vaccine. Kids, they have no vaccine, so they have only 2 admissions. So now there are 10 admissions in adults, 2 admissions in kids. That has not changed. But now it will be presented as a 5-fold increase in the kid hospitalization. So, oh my God, what happened to kid? It's just the same facts twisted around by people who don't know nothing. They don't know science, they don't know math, they don't know media, nothing. And we just keep consuming that. And media has the power. It's very easy to blame the media because we like to blame somebody who doesn't care being blamed. They just wait it. But they have some responsibility too. In 1898, when the Spanish-American War was about to start, William Randolph Hearst sent a reporter to cover the war in Cuba. And he said, send me the pictures. The reporter cabled back, that time there was telegrams, that there's no war here. Hearst got mad at him. He said, you stupid reporter, you send the pictures, I'll send the war. So then he arranged so that America got into war with Spain. So media can shape the narrative. But at the end of the day, we the people are the king. So we have to, all people literally work for us. So we have to not click on something that we think is right, we not. So they say, even media politicians, they prefer notoriety to anonymity. So even if a YouTube video that has a lot of dislikes, it's put forward by the YouTube algorithm, So if you don't like something, disliking it is making it viral, So just stay away from that. So I don't think Omicron is going to be a big deal. The South Africa wave has come and gone. It's gone. How do you know? Because they don't cover South Africa anymore. There's no coverage of South Africa. So in India, there are 3 possibilities. First, that it has come and gone. Second, that it can't come in India. And the third is that it is yet to come. The fear for the government for which they are doing a lockdown is, even if the wave is like this, when it goes to the top, in fact, suppose Delta was sending 1 person out of 1,000 in the hospital, and Omicron sends 1 out of 1 lakh. If there are 10 crore cases, we would have enough hospitalizations to overwhelm the system. And once the hospitalizations start increasing, there will be news that there are no beds. So then people will start occupying beds. Then there will be more stories. Then there is WhatsApp. Then there's forward. Then the pan bajega. The thing will just spectacularly fall apart. So I think there are a lot of good news also. Paxlovid, Evusheld, which honestly, how many of you would have to Google Evusheld to know what it is? And therein lies the narrative. Evusheld is a medication developed by AstraZeneca. It's not a vaccine. It's a medication. It's for immunosuppressed people. You take 1 shot, you're free for 1 year, including Omicron. So we could cover the immunosuppressed people with 1 shot. I praise the government for bringing Covaxin. But most of the approach is so haphazard. People over the 60 have to prove they're immunosuppressed. The vaccines don't work that well in immunosuppressed. Maybe give them the Evusheld and open boosters to everybody. But why not give boosters to anybody who wants it? So those are the 2 things which will blunt. If you look at hospitalizations, they're 40% down compared to Delta in UK. In New York, when there were similar cases, there were 15,000 hospitalizations. Now they are 1,100. So the hospitalizations are definitely down. In South Africa, with beta it was 16.2, with alpha it was 15.6, with Omicron it is 5.6. 5.6 might also be too much, so we don't even want that anymore. But my thing is, I think we are okay. There's not going to be any third wave. Just the despair can kill you, literally. The immunity is reduced by the fear, and you have a dual responsibility. Your friend, your relatives can see that fear reflected from your faces. Like Franklin Roosevelt said, we have nothing to fear but fear itself. So just don't worry. If that doesn't mean don't be careless. But the one thing that I like literally abhor is I get nightmares about that. Is people coming on TV and saying people don't follow COVID appropriate behavior. What the hell? Means it's 2 years. People are following. They're following the COVID approach. What a waste of oxygen. When they come and say, wash your hands frequently, this. What does it even mean, that meaningless drivel? What's the meaning of that? The chance of corona spreading on surfaces is 1 in 10,000. I'm not saying not wash your hands. It will help you. I'm not saying everybody should wear mask. I totally support the mask, that they're easy. But it should not be our ambition to wear masks for the rest of our life. And if somebody is not wearing the mask, don't tangle with them. When you go tangle with them, you're exchanging COVID. So just leave them alone. You should request people to wear the mask, but it should be a request. Okay, that person could be having some problem. So I think we are going to be okay. We are in good place. So if we want to answer in 2 words why there is not going to be a third wave in India, and those 2 words are second wave. We have suffered so much in second wave, and there are so many waves of natural infections. With behind each positive case, I think there were 50 people who are positive. Now with Omicron, if it pierces the immunity, you can get cases, but that's what I'm saying. Stop counting the cases. Look at the hospitalization. What difference does it make if it doesn't kill you? The difference is you may give it to others that you may care, but most of them are protected anyway. So we have to only isolate the people who are at risk of high risk. We can't really isolate them. We can't lock them down. We cannot do a lockdown of unvaccinated like Austria did. But we could do something. We can give them the solution, and then everything is open. Or we could do a lockdown of the unvaccinated. It is harsh, but it is coming to that. So it's either that, because all this theories, the conspiracy theories, vaccines work. Even with Omicron, the chance of death is 14 times higher if you're unvaccinated. The chance of catching mild COVID is 5 times higher. Those are just the plain facts, they cannot be ignored. And this is not like some cooked up media. So this is, I'm seeing it. Unvaccinated people are getting, and they are bringing the whole health system down in US. 30% people won't take it. I don't blame them in Germany or Austria. 30% people have not taken it, and they're not going to take it. Because of the Nazi regime, they're so fearful of totalitarian regimes that they are totally against mandates. So they are not going to take it. But interestingly, they are going to take monoclonals. Now, amongst the Eli Lilly and Regeneron, they are not working that well against Omicron. So we need the Sotrovimab. But if you Google Sotrovimab and India, I got the first hit was they're asking me to buy some Geo cell phone. It just doesn't make any sense. So Google Sotrovimab and India and see what happens. I think we're going to be okay. We have to be smart. I've been asking for it like for 5-6 months. Do daily press conference. Stop counting cases. Test only symptomatic. Treat problematic. Bring all the vaccines. Start boosters. No babugiri for boosters. We don't need to know who you are. Open the stadium. Keep doing it till you run out of the doctors or healthcare workers. Approve Evusheld. Give it to immunosuppressed people. Stockpile Sotrovimab. Open everything and be done with it. So that we could have done it a long time ago. So we can, at this point of time, open it for questions.
Why don't you have Steve and the first?
Can you hear me without the mic or not?
We are not streaming it, so it's better with the mic.
Can I do those shoulder type gestures? I had my
Color mic? You want the color mic?
no, not collar mic. Do you have like a Apple mic or something?
No, I can make that.
Sorry.
No, this one. We want those gestures.
And Dr. Patwardhan will tell you this is typical selfish KEM hostel acting. You just don't care what other person wants. You just get what you want. We know.
While we are getting set up with the mic, I think that was a brilliant presentation, put it very simply, and that will bring rise to many questions. So I'm going to converse and ask you some questions for maybe say 15 minutes and then open it up to the audience.
This is really cool though. This is really cool. I feel like a telemarketer. I try to give you the highest possible satisfaction today, sir. And when I call them, that's all they keep saying. Yes.
And today, I think through your conversation, we'll be satisfied because we would have despair and we would be fearful and we would possibly be able to kind of separate between the myth and the fact. So the first thing that I want to talk to you, Dr. Godse, is the media shapes our narrative, right? And every day people get up to COVID news, and now over the Christmas season and New Year season, where people are just getting a little bit relaxed. Delhi has imposed curfew, Maharashtra cases are the highest. So how do we not despair in such a situation where media is shaping the narrative?
Because knowledge may be power, but ignorance is bliss. What you do not know cannot hurt you. Just ignore it. When you call a friend in the morning, don't ask what are your cases, what are my cases. Why are we even looking at the cases? I mean, they say there are 415 cases of Omicron, right? How many are symptomatic? Why weren't they tested? And one data said, out of those 415, 70% were asymptomatic. Then why were they tested? Then why are we testing asymptomatic people? To protect others, right?
Yeah.
We cannot protect them. We cannot stop Omicron. If it is 6 times more than Delta, there is no way it can be stopped. So you need at times the management principle. I cannot do this. Like we had a headache viral, and I opened Gray. I was reading the cranial nerve. Then I can do it in one day. Just forget it. Just forget it. Right? So you need to know that what you cannot do. We cannot stop Omicron. Omicron to पकड़ना मुश्किल ही नहीं, नामुमकिन है. It's just that. But Omicron डाउन नहीं, भारत का विजय होगा. So it might turn out to be India's booster and Africa's vaccine. But we have to be very careful that while we are allowing it to spread, it doesn't mutate. That's the problem. We cannot stop it from spreading. So right now we can just stop it from creating a lot of serious illnesses. And that we can do very easily. We are okay now.
But on the one hand, you say that there is no way to stop Omicron. But on the other hand, you are saying we should not be testing. We don't know as common people what is the way. Thoda sa kind of halat mein we want to be able to test. Then there's asymptomatic, then there's symptomatic, then Maharashtra and the entire country is just reporting cases.
Okay, I'll stop you. You are Sachin or Ahmadiyya or Sholay, right? And you devise a test to detect Gabbar. So you test people and you detect, you know who Gabbar is. So once you know who Gabbar is, what the hell are you going to do about it? What can you do? Ahmadiyya just sits on that horse and goes. He's nothing. He's not able to do anything. So why find out? What is it that you do if you test positive? What is the treatment? It's the same RT-PCR test, the same vaccine, the same. So there is nothing changed. So if that person gets sicker, we can help them, right?
Yeah.
But that help needs to come within 3 to 5 days in high-risk people. So Paxlovid is not approved in India yet. Molnupiravir doesn't work that well. So what I'm saying, test only those people in whom testing will make a difference. Why do you need to know that you have it? There was a hematologist, he really didn't like me. It's okay, I didn't like him too. So he was teaching thrombophenia. And he said, if a patient has low platelets, look for spleen. If the spleen is swollen, do a bone marrow biopsy. And if the spleen is not swollen, do a bone marrow biopsy. I said, then why touch the patient? Why even talk to him? Just look at the platelets and send him for a bone marrow biopsy. Who cares anyway? Who wants to waste time talking to them? And just send them for another test. So, what is it that we are going to do if you test positive? So the important thing is, when you are doing the test, you are also taking the test result away from somebody in whom it would matter if the result comes positive. To continue in Sholay example, if Mausi is casting, don't tell Jay and Viru because they are traveling. Otherwise, by the time her test result comes, she'll be chutki pissing for the rest of her life because we won't be able to give her the Streptomycin antibody. So we have to be smart about it and focus. Sorry, go ahead.
One thing you said that Omicron is coming and you started your speech that there will be no second wave.
No third wave.
No third wave, sorry. If it's coming, then it can be.
The wave is made by hospitalization, not by cases. And when I say it is coming, it might have already come and gone. And if it comes, it cannot spread because of the herd immunity. If it is yet to come, and if it spreads, it will be a very quick, sharp burst, and we'll be able to stop it because of what we know. In Marathi, there is saying that, Landa ala re ala. So most of the time it is the sharing, But now we are so strong that even if Landa comes, we'll kill him too. It's not a big deal. So we are at that position, खुद ही को कर बुलंद इतना कि हर तहरीर के पहले खुदा बंदे से पूछे पता तेरी रजा क्या है. So we are at that position.
Thank you. I mean, it's really nice, and this is being streamed live. So hopefully we'll be able to change the media narrative.
No, you won't be able.
We won't be able to.
It's like उसको बदलना मुश्किल ही नहीं, नामुमकिन है. हाँ, नामुमकिन है. वो ओमिक्रॉन चला सकता है, लेकिन वो बदल नामुमकिन है. You cannot change it. You need to know when to take the thing and go on.
But then, what would be your suggestion for the government? Steps what should they do? Because every day through the government there is fear. Every day we know.
We just said those 8-10 steps, and I've been saying it for the past 5-6 months. And then listen to me.
Yeah.
I think they take a decent 3-month interval to reduce the effectiveness of that, and nobody can accuse them of listening to the same voice. So they take a decent 3-month interval. When Covishield I was actually pretty unpopular with some of my doctor friends in January 2021, when I was saying, why are you allowing 2 doses of Covishield 4 weeks apart? The science is 8 to 10 weeks, 10 weeks, 12 weeks. The science was so clear on that. And I was saying, my physician, why are you taking it weekly? Tell the government, don't do it for 4 weeks. And the government's answer was, I was the vaccine committee chief was with me in a TV show. He said, if there is a 12-week gap, people won't show up for the second dose. So they are saying, Dr. Sancheti, they don't trust Dr. Sancheti to come off after 12 weeks to take the shot. What kind of argument is this? Then they say we can afford Pfizer. They're telling Amitabh Bachchan that we can afford Pfizer. So what kind of arguments are these? So I think the government steps we have laid down in all those videos. So, and it's good. It's easy for me because I don't have any actual responsibility. All that I do is, my wife is a physician too. Before that, she was an IIT girl, like all my IIT girl who switched to medicine. So I'm pretty afraid of her. So that's why I go in my car and make those videos. So nobody's listening.
I've seen those videos when you're in your car.
So I have nothing to do. I have only to fear my wife and my daughter at the home. So I just go and sit in my car, make the videos, say whatever comes to my mind. Literally whatever comes to my mind. And then so government has to take it with, their response has to be sane, and they say, how could you be a doctor and say such things? But at times, this irreverent disregard that you show to the seriousness and bring the smile to a patient's face, that helps. And in one quick word you can say, like there was apparently, I had offended Nirupulaji, apparently there was something going on. I don't know, like I actually frankly never read the comment. So I said when the virus mutates, I said that Kader Khan doesn't become Vajan Timara. Kader Khan might become Shakti Kapoor. So people like this movie.
Yeah, they do.
And my always saying is, where we are, India is world's #5 economy. If you consider the wealth of the Indian diaspora, India could be #1 economy in the world, like Israel does. So I said, we are like Rani Lakshmi, we are like Sulan Devi. So we keep acting like Raki in a white sari. कि कोई है क्या मेरे ऊपर आके अत्याचार करने को? What is going on? What nonsense is this?
So the government should definitely take steps for making us Sulan Devi and Rani Lakshmi Bai.
Yes.
So what now the government has announced booster shots and the fact that it should be a different mix. I wanted to throw some light on this one. Booster, after how long and what is the efficacy of the booster?
I've been talking about mix and match since January, when the vaccines were out. There was a South African study, idiotic study of course. I think it must have been Lancet, it was idiotic. Is it like I'm getting the
So that's okay. To run the device.
hello?
Have you done this? Have you done this? Have you done this? What you are having?
Okay, sorry about that.
No problem. So the study was idiotic, but it said that if you have taken 2 doses of Covishield against mild disease, you have 0% protection. 2 doses of Pfizer, 30%. 3 doses of Pfizer, 75%. And 2 doses of Covishield plus 1 dose of Pfizer, 71%. So we can get a cheap and easy vaccine first and just boost it with mRNA. So we could do that. And heterologous prime boost is very well known. I keep saying that if you have Tendulkar and Sehwag on your team, don't add Virat Kohli. Take Akshar Patel or Ashwin. So make your body defense all rounder. So I've been saying it for a long time. Angela Merkel took first dose of AstraZeneca and second dose of Pfizer. Covaxin could be a nice complement to any of the world's vaccines because it's a whole variant vaccine. So my Twitter handle at Dr. Godse everyone, my Twitter handle, and I'm having so much fun there with all this filmy dialogue, Hindi, Marathi, English. One of my handles over there is Bachenge Nahi, Bechenge Bhi. If we bring mRNA vaccine to India and do study of 2 doses of any vaccine plus Covaxin, 2 doses of Covishield versus Covax versus mRNA, Pfizer or Moderna, we may be able to sell the third dose to the entire world and make billions of dollars. That's why I keep asking for the mRNA vaccine. And then people accuse people like us of being agents. That is so, I don't want to say it's hurtful because there is so much misconception during that. So it's a very valid question that people to ask, like, do you get any commission by the These drug companies are not nice, but they have a nice product. So we need to bring mRNA vaccine. So India's vaccine chief was with me on a TV show, and he said India has a mRNA vaccine that is way better than Pfizer and Moderna. I said, great. Nothing will make me prouder as an Indian. When is the vaccine coming? He said 8 weeks. I said, fine, give me Omicron's cell phone number. You must have it, right? You must have called Omicron saying that wait 8 weeks. We are bringing the thing. Did we take an oath to cure a patient only by using desi medicine? CT scans and MRI, where are they produced? The storm of the HR CTs that we had unleashed on the Indian population, where are those machines made? So I think the mix and match will work. I have so many patients. I tell them I can't give them medical advice, but so many Indians have come, affluent Indians, have come to US after 2 doses of Covishield and taken a Pfizer or Moderna booster. If I want to do a study of them, there will be thousands of people. I was asking Sandeep and Manisha to fly to Pittsburgh and meet them with Moderna on the airport. We'll give them the shot, give them a cup of tea, Pune style, and send them back. So there's so many people are doing it. So I think when our Prime Minister spoke, it should have been clearer at the meeting. Don't leave any doubt for confusion. Just like Leonardo da Vinci used to say, simplicity is the ultimate sophistication. Approve boosters for all. If you have taken Covishield, Covaxin. If you have taken Covaxin, Covishield. And no need to register anything. I'm saying open the Pune Stadium, one gate for Covaxin, one gate for Covishield, play music, play cricket there, people come in, take the shot, go. You keep doing that till you run out of doctors and healthcare workers. Done. Why wait till 10th January? Waiting till 10th January. Why wait for 14 days? I keep saying या तो घोड़ा बोलो या तो चतुर बोलो. एक तो तीसरी लहर आ रही है, नहीं आ रही है. आ रही है तो आज करो. नहीं आ रही है तो आपके पास टाइम है. ऐसे नहीं आ रही है. So don't worry. But the thing is, this thing, India approved vaccines on 3rd Jan. But the drive started on 16th Jan. India's drive is spectacular. Nothing makes me prouder as an Indian to look at how many crores of people we have vaccinated. Great job. All I'm saying is, we could have done it 13 days earlier. Start it on 3rd Jan. So when the vaccine was approved, that creates a wave of happiness that I got the shot. So on 3rd Jan, give 10,000 doses. Do something and no Babu will. If there are terrorists in India who have come to attack us, they can get COVID too. They can give it to others. Just give them the shot. You don't need to know who they are. So I think that is, our system is very good, but it needs to be more resilient. So it needs to adapt. It needs to change quickly.
For sure. I mean, resilient, I agree. Speed, I agree. But I think the sheer population of trying to get this done and the whole rural urban mix and how do you reach the last mile has been always a problem for India. Managing the leadership, and then we have different leadership in state and central.
As I said, looking at it, it's very easy to talk about it. But overcoming that challenge and giving the vaccine is a great job. My only minor dissension was, there was like a old movie, Prem Chopra is driving in some basti, and he hits a old guy like, AK Hangama, whoever, number. And Amitabh comes and says, सेठ क्या गरीबों के जान की कीमत नहीं होती है अमीरों के जान की भी होती है ना मतलब don't discriminate in health अमीर गरीब the people who wanted to buy mRNA vaccine why were they not allowed in December and Jan bring it to the airport all the rich people yeah when I was about to say something controversial the mic acts up it's like a conspiracy so the rich people would reach there with all their stuff. Delta came because enough people were not vaccinated. My prediction. Hold up later. Is it on?
Yeah.
Is it on?
Yeah, it's on.
Hold up later, so I'll add my gestures in that. But Delta came because enough people were not vaccinated. And said if 15% Indians were vaccinated, there will be no second wave. And most of the second wave was self-inflicted. We were looking for beds and WhatsApp and all those stories. I think we literally did it to ourselves. So no third wave.
So it came from South Africa, and now you said in your presentation, Kyata, we don't even have a count, and we are talking about UK and US, where the cases are really increasing, 193,000.
Let's first talk about South Africa. If it came from South Africa. South Africa, as of 2 days ago, they have stopped testing symptomatic people. They have stopped the isolation of COVID positive patients who are not symptomatic. They can return to work earlier. United States has resumed flights with South Africa. They have approved the boosters. They have opened everything and they have moved on, and their cases are crashing down. So India is going to go by South Africa model, and we won't even have that increase. All the problems in US and UK are because of a large swath of people who are unvaccinated. But UK is trying to fight it smartly by giving boosters to vaccinated people. UK has already reached 45% boosters. Next week, the cases in UK will start crashing down. It's my prediction. So it is said, and so it shall be done. So it should be written. 100% right. No chance of mistake.
Then I should say आपके मुंह में घी शक्कर, right? Continuing with the way that we are looking at it.
आज भी डाली तो चलेगी. It's guaranteed. 100%.
Okay, definitely. And then all over the kids have been vaccinated, but in India, of course, again next year
It's not really all over. Cuba started it. China started it. US is giving over 5, but only 16% of population between 5 and 12 is vaccinated. Look, the chance of a kid getting seriously ill is very low. If you get millions of cases, you are going to see hundreds of hospitalizations. That's just a given. As we say, Netherlands is running out of ICU beds. Even during best of the times, Netherlands has only 6.9 ICU beds per 100,000 population. Germany has 19. United States has 14. So Netherlands to begin with is a disaster. So you get more cases and the system crumbles. So kids are going to be fine. My only problem is my at Dr. Godse Ravi Twitter inbox is flooded with parents asking me questions about kids. They are not ready to send their kids to school. So for this perceived fear of corona, we are breeding depression.
Yeah.
And that pandemic might last for 60 years, a legacy of an incompetent.
I mean, it's 2 years since our kids have gone to school, and there is obviously depression, there is regression. They haven't been able to study so much on it.
Yeah.
Schools won't start.
Dr. Patwardhan is like a very humble and a selfless doctor, but I want him to have more business treating kid injuries. The kid injuries has to be the only spike that we see. The kids need to be on playground. We need to see scraped knees and we need to see fights, and that's how you develop normal life. Not this just sitting. Because of all this, they're canceling the elective surgeries. A 70-year-old who's really looking forward to going on a trek with the end-stage hip, subjecting him to 3 more months of pain is inhuman. All this, a cancer screening, postponing it by 3 months is just not right, but we are forced to do that. I had a lady who had fallen and had a hip fracture. So she came to me in Pittsburgh. Some brilliant person wanted to swab her for COVID. We swabbed her, she was positive, no symptoms. Now we can find her a rehab because they won't take a COVID positive patient. So she's sitting in the hospital till she's able to walk. So whole hip rehab, we get the hip people out of the hospital in like 20-30 minutes, and she's just sitting there for like days on end. It's just ridiculous because we swabbed her. There was no need to swab her. But anyway, I digress.
We all look for rules and regulations, and you're right. I mean, there's no elective surgeries. People are scared. People are scared to come to hospitals. They'd rather take painkillers and do it. But a lot of things we hear these days is the reinfection. I took 2 vaccines. I took a booster. Yet I am infected with a vaccine. If people are saying that they got 2 doses of vaccine and they still got infection, I don't know what to say. The healthcare workers took 2 doses of Covishield 4 weeks apart in December. Their efficacy was 55.1%. So you had a 44.9% chance of catching COVID if you come in contact with a COVID patient. It's like Virat Kohli saying, I lost the toss. Yes, dude, you lose each and every toss. That's how you operate, So that was your chance of catching COVID. So catching COVID is not a news at all. The news should be not, I got 2 doses, I still got COVID. The news should be, I got COVID, but I had 2 doses, so I didn't end up in the hospital. Against Delta, Covishield might have been 35%. Against Omicron, it might be 15%. But it still protects you against serious disease. Pfizer was 91.6% against original COVID. Covishield was 55. But against serious disease, Pfizer was 95, Covishield was 96. So Covishield is a great vaccine. It protects you against serious disease, and that's what you want. You don't want to end up in the hospital. You don't want to end up having serious disease. So reinfection, Omicron, they say, can evade the immunity. So even if you had COVID, even if you had vaccine, you can still get the disease. But it's a mild disease. There's some conspiracy in my own mind whether Omicron is really mild or it is appearing mild because we are protected now. And Omicron still may be Gabbar, but we are Jay and Viru. Tumne ek mara to hum 4 marenge. But I don't know. I think it is still mild,
So I don't think we have anything to worry about. Even if there are reinfection, I would request my doctor friend, in case you get reinfected, don't put that story on WhatsApp that I got 2 doses, I had COVID, I got reinfected. That story goes like viral like anything, and it just keeps, and they keep getting sent back to each other, you know. You send it to a friend, your friend will send to one of my friends. You are that friend. That suppose that you're gay. You are the friend that they are talking about. But this spread like wildfire. So just get better quickly. I don't even think the people who are symptomatic need to isolate for that long if they're asymptomatic. In New York, you can come back to work in 5 days, even if you're COVID positive, if you don't have symptoms, because we don't have the workforce anymore.
That was my question because I've been reading that in New York it's 5 days. Here we are still 14 days, and now if
Actually, isolation is 10 days, quarantine is 14 days.
we still isolate.
People who run it don't even know the difference between isolation and quarantine.
No.
If you develop COVID, you isolate. If you come in contact with the patient, you quarantine. But if Omicron is 6 times Delta and we were nowhere close to stopping Delta, how are we going to quarantine people who come in touch with the Omicron patient? The whole nation will be in quarantine in 1 day, and economy will be in the tank, never to recover.
Now I agree, but you say that the negative stories get picked up because that's how everybody talks about it. I got.
But what I know is like how many people, I'm sure a lot of hands will go up. How many people know what Paxlovid is?
Elaborate. I've heard your video, so
Paxlovid. It's like in asking after seeing Sholay 100 times how many people know who Jay is. Paxlovid is a Pfizer medication that works against Omicron. If taken within 3 days, 89% effective to take care of everything. To be given in high risk people who are mild to moderate symptoms. 89% effective. There is no news. There is no coverage. So those positive stories also need to circulate, and we need to start forwarding them.
how do you think we are going to be in 2022, 2023? The mask, the hand sanitization. What will normal life look like?
हम के मगलूबे गुमा थे पहले, फिर वही है जहां थे पहले. ख्वाहिशें जुर्रियों की तरह उभरी, जख्म सीने में निहा थे पहले. आंखों से जैसे कांटा निकल गया, अश्क आंखों से रवा थे पहले. दोष पर सर है या हुई है बर्फ जमी, हम की शोलों की जुबां थे पहले. अब तो हर ताजा हादसा है तस्लीम, हादसे दिल पे करा थे पहले. मेरी तन्हाई हमजाद है मेरी, ऐसे रिश्ते कहाँ थे पहले. ये कब तक करोगे यार? We are just stuck into that vicious cycle. Just move on. Forget it. It's all going to be over. It's already over. It became an endemic in July 1st. Stop watching my videos. Only those hopeful ones. When I say like do this, do that, don't watch them. Just do something else. This is done. It has become endemic in India in July 1st. And India is capable of dealing with it. Our own people, our jugaad, the jugaad that we find a way, we do something different. That can only happen in India. Only happen in India. Some of the things that their brains like totally think in a different way. So that's, I think that is going to take us through this difficult period. I think it is already behind us. I don't want to quote too much Urdu, so something. कि सुबह कब आएगी? नहीं सर, आई शहर तो बड़ा बिजलियों का जोर, शब भर हम इंतजार शहर देखते रहे. अरे शहर कसली बोंबलायला. मी सकाळ होऊन दुपार झाले ते चितळे बितळे बंद होऊन शर्ट बिल्ट काढून झोपले लोक पंखा लावून काय. एवढी दुपार झाली आता टळटळी. तुम्ही सकाळची कसली वाट बघताय? It's done, it's okay. We are fine.
I really like the way you have an example which is simplistic, which makes it great for us on a Monday morning to be hopeful. There's nothing going to affect us, and that's the news that we need to hear. And as healthcare workers, we are responsible to spread the positivity and the positive news. I have a few questions, but I want to open it up to the audience. I would love to take a few questions and then we can call it a wrap. How much time do you have?
What time is it?
It's 9:18.
Yeah. We have 10 minutes.
Okay, great. So I would love
I'm going on a
to
cooking show.
Sorry?
I'm going on a cooking show.
You're going on a cooking
I
show?
have no clue why. They're going to repent it. I'm going to make them repent for the rest of their life.
I would love to hear your surely euphemisms in cooking. Yes.
So you spoke about the vaccine. First of all, an excellent lecture. So the vaccines, you said if you taken Covishield, you take the other one.
Covaxin.
But my question is, if it was the first time you had to take a vaccine, in today's time, pandemic is just coming, the corona is just coming, which would you have recommended if all were available?
If you,
Number one vaccine.
if all the 3 vaccines were available to you in India, if your age was less than 30, and if you're female, I would recommend Covaxin.
Okay.
If your age was less than 30 and if you're male, I would lean towards Covaxin, but Covishield would be okay. Between age 30 and 60, either Covaxin or Covishield. More than age 60, Covishield for sure.
What about these Moderna and Pfizer?
Oh, if they were available, I would go for it. Oh, if they were available, I would go for them. Moderna made a mistake by using a higher dose. So they saw some pericardial inflammation. But when they did a study, the chance in a natural population, the chance of developing COVID and then developing myocardial inflammation was more than developing myocardial inflammation from Moderna. But Moderna used a higher dose, so they had higher efficacy. Now they only use half a dose per booster.
What about the MCure vaccine which is coming up? What is your opinion on the MCure vaccine?
Which one? The Genovia vaccine, the mRNA vaccine, India's mRNA vaccine?
Yeah, mRNA vaccine. If there are 2 months, it should be launched.
Yeah, but 2 months is gonna be 2 months too late. Should have been launched too. This is ridiculous. We have mRNA vaccines already on the market. What happened to Zydus Cadila? The vaccine was approved 2 months ago. I never hear about Zydus Cadila anymore. What happened to 2-deoxyglucose? What happened to Virafin? All these news come for one day and then they disappear forever. Like never to be heard again. So if mRNAs were available, actually taking 1 dose of Covishield and 1 dose of Pfizer or Moderna as a mix and match. There are big studies. There's a COMCOV study, there's a Sarland study. That would be ideal for the world because then you take one vaccine that is stable at room temperature or like room at refrigerated temperature and one vaccine that needs tricky handling.
You say that you should take vaccine every 6 months now for the rest of your life. Is that true?
No. Actually, the people who have taken Covaxin, they have more all-rounder protection lasting longer because it's a whole variant vaccine. It's an RNA vaccine. You'll probably need boosters every 2 years. And those boosters need to be adjusted against the variant. I was very upset with US when they made us take the same booster. Why not adjust it against Delta? That would have been better. But we are using the same RT-PCR test to diagnose Omicron. So how much has it really changed? I don't think it has changed that much.
Right.
I think it's okay.
Anybody else? This is your chance to get all the information with movie dialogues and euphemisms and cricket. So don't lose this opportunity. Otherwise, I have a few more questions that I will ask.
You ask one and then I'll ask one more.
So I want to talk about long COVID. What about long COVID?
All my patients have gotten better now. Who started from, part of it is psychological, there's functional overlay. Just look the patient in the eye and say, eventually, all of you are going to get completely better. The people who have had COVID lungs, some of them were already high risk and had issues. But the damage in COVID is mostly due to small clots. And in my experience, all those patients are also getting better and better every day. I can say it, I don't want to jinx it, but all my patients have gotten completely better. Everyone, each and every one of them.
So today, what is your current take on how long should a COVID positive patient be isolated and when should he be retested? Should he be retested at all or not before joining work? What is the current guideline on that?
But you have to follow whatever the state government and institutional guideline is. I think retesting a COVID positive patient just tells us that the people who manage it know nothing about this disease. COVID is a thief that is entering your body, and antibodies are the police. COVID tries to enter, you do encounter, You kill COVID. COVID is Thakur Baldev Singh. You have cut his hand, it is laying in your drawing room. That hand, which is dead, is still going to test positive on a genetic test for a long time. So there is no need to retest a COVID patient. There's absolutely no need. If you have had COVID, you should isolate for 10 days. That is the current guideline from the first day of symptom. If you never had symptoms, from first day of positive test. Why would somebody be tested if they had no symptoms? Now South Africa is saying if you have no symptoms and if you test positive, you come back to work in 7 days. New York is beginning to say 5 days. And very soon the Western world might say, just forget it. If you have no symptoms, just come to work. But my tiny question to them, my nanda sawal, my chimukla prashna would be, then why the heck are you testing these people?
Because there is a guideline still that if you are positive, then the immediate contact has to be tested. Here, at least in India. So your immediate family members have to be tested, or those who have come in.
Right, and then some of them are going to test positive.
Yes.
Now I don't know whether their contacts need to be tested. With Omicron, you will get over. South Africa stopped contact tracing. Even Singapore, who are not smart at all about this, like they have stopped. If Singapore stops it, that's like taking the cake, which is like Aadhaar card being reformed, so it's like can't get any worse than that, so.
But India is big on contact tracing. With PMC, BMC, with the phone, you had made, you have travel. It doesn't get over. They are very, very structured with this. They will do the contact tracing. And schools have got shut with 2 cases. They shut down schools. Now again in January, you don't even know if they're going to open.
Well, I want to be polite, but also they are wrong.
But in Singapore, they still, have to upload their test, the R&D test.
They are doing it, but there was one tweet that I had written, but I didn't send. That tweet was, if a person has had 2 doses, has taken a booster, maybe is COVID recovered, wears mask all the time, has a RT-PCR negative, if you're asking him to do more, then why the hell have the pretense that things are open? Just close everything, prepare to die, go to hell. Where does this end? After this, something else comes. The schools are closed forever. We are only breeding politicians, no scientists, no doctors. Schools are closed, What are we going to do? So I think a point comes where you have to be realistic, as to we don't want the overwhelming of the health system. But what are we going to do? How many people will how will we contact trace a bus conductor in Bombay? 3,000 people that he has given tickets to. If 1,600 of them test positive, are you going to trace their contacts? You will be contacting it will be easier to do and that's the lockdown. Because you cannot contact trace everybody, then do the lockdown. I would say do the lockdown of unvaccinated and give them a chance to come out of the unvaccinated lockdown by paying for 3 doses of Evusheld. They take 1 dose and they pay for 2 immunosuppressants. This is very harsh on unvaccinated people. But harsh times require harsh measures. So that's the way it is.
This drug which you're saying for the immunosuppressant, so can we take it as for the normal person?
That's what I like about India. The Indian brain works so differently. This is the brilliant question that goes to the crux of it. If it protects immunosuppressed people, why not use it on? So I suggested give it to India's entire cabinet, give it to all top police officers, give it to so that we know these people are safe for a year. And if the drug is commercially available, I said if a doctor who wants to take it for extra protection, there's hardly any side effect. Why not? Only problem. No, not yet. The thing is, they keep saying that if you take it, if Dr. Sancheti takes it, a person who's poor is not going to get it. It doesn't work that way. Making a rich person poor doesn't make a poor person rich. I keep saying it, that a rich nation helping a poor nation is taking the money from the pockets of the rich people in poor nation and putting it in the pockets of rich people in poor nations. This is just as simple as that. So I think the doctors want to take, I think they should go for it. Right? I'm actually recommending it to anybody over 80 And what is immunosuppressed? It's like all those cancer patients and all that. But if you feel your immunity is low, especially if you have taken a vaccine you think has a, the thing is the vaccine protects you against serious disease. But with the booster, now you don't even want mild disease. You want to travel. You want to go to Europe. You want to go to Disney. You don't want a stupid test coming positive after you have bought uh, non-refundable tickets.
So there have been major problems for people who face COVID, like cardiac issues and complications, and they continue to face it. And what is your thought process of that?
It's just a clotting disease, so it can cause a cardiac clot too. And some of them were attributed to the vaccine. And I keep saying that how many bicycle accidents do you think you have in Pune every day? 10?
Maybe more. 40.
40? Okay. Suppose you have a magic wand and you vaccinate entire Pune, both vaccines in one day. Just you do magic wand, entire Pune vaccinated. You know what will be the stories on WhatsApp next day? Sala kal vaccine liya, aaj cycle se गिर गया. And then we are forwarding it to each other till cows come home. So when you give vaccine on such a high level, the things that would have happened by chance are attributed to vaccines where they should not have been. That's just simple statistics.
I have one last question.
Okay.
So, do you believe that this virus is man-made?
We are on live TV, right?
Yeah, we are.
But the thing is, I don't think so. Because if it is man-made, it was made in China. And the way China is managing the disease, they know nothing about this. The way they are managing it. They're trying zero COVID. Zero COVID is idiocy. Testing, tracing, isolation is idiocy. And they're trying to do it. They're doing 60-day quarantine. Actually, quarantine means quarantine journey, 40 days in Italian. I don't know how could there be a 60-day quarantine. But they're shutting entire cities in China. China is not. I don't think it is man-made. And we are at a point now. If you look at the history of human warfare, if the point is just killing the other person, like how do you decide that this is not ethical? Like 600 years before Christ in Second Peloponnesian War between Athens and Sparta, there were some cases of plague, and they chucked those dead bodies over the wall to infect them with plague. That was sort of the first biological warfare. So that is bad. But why is it bad? Why is it different than sticking a bayonet in somebody? If the point is killing them. So till the other nations develop that weapon, it's always inhuman. So like same thing was about the nuclear weapon. No, you can't use chemical weapons. But long as there are human beings, there's going to be warfare. And then till the other side develops it, they'll keep calling it unethical. I don't think it's biological warfare, but I don't know. Trump had won the re-election in US. अमेरिका का एक हाथ चाइना के कान पे होता और दूसरा जेब में. Right? So we would have taken their money and we would. I have no people with Chinese people. I have great Chinese friends. They're like us. They're hardworking. They're kind, nice. They respect their elders a little more than us. They educate their young. We have the problem with their government. Somebody needs to stand up to China and tell them enough is enough.
That's truly enough is enough in terms of where we are. My last question to you is, we love Bollywood. India loves Bollywood. Everybody loves Hollywood. And I've had many conversations with experts, but this one has been very, very interesting because you've always mixed it with, movie dialogues. But you tell us about your life as a movie director and a physician.
Well, the thing is, if I tell you that I'm like a very famous movie director and then I have to tell you the names of my movies, it doesn't make any sense, right? So the movies have to
No,
be
I know your movies, but I want to know your life.
But the movies have to be popular too. No, but I love history, I love traveling, and I love doing things that are like totally unpredictable. It's just totally means my family members are like, that's my modus operandi. Like, there is no telling what I would say where. So I was 2 years old and I was sitting in my mom's lap and she was studying for MA and all her friends were visiting her and they were talking about their mother-in-laws. And I just started talking. I raised my hand and said, but they are not here, so we don't know their point of view. So those people got so scared of me that if you see me in Baba Gadi going on one side of the road, they would cross to the street. They're still avoiding me. So that's my take, that say whatever comes to your mind. Half the time it works, half the time it doesn't. Who cares?
That's incredible. Thank you so much for your time. It's been insightful, it's been entertaining, it's been humorous, it's been very simply put. I think today we go back with a lighter state of mind. We feel that there is hope, we feel that we will get through this. And thanks to you for that. A big round of applause for Dr. Godse. Thank you so much. I would request Dr. Parag to come
And the first page of Love Belly, the surgical textbook says, we cannot take hope away from the patient.
Absolutely.
Hope that comes to us all.
Absolutely. Thank you so much, Dr.
Thank you.
Thank you so much for spending your Monday early morning with us, and good luck with the cooking show. And thank you so much. We really enjoyed the conversation. Thank you so much.
So, thank you very much, Dr. Ravi. This was a splendid talk. When Sandeep did tell me, I had heard about you, and to be honest, I've never seen your videos, but be sure I will now. But in this 1 hour, what you told us is really something which comes with a lot of scientific data, even though you make it so nice with your command over dialogues from Hindi movies and your excellent memory to remember people and just narrate them out of nothing, as if we say Baba Black Sheep, you say all these things so well. So that really made it more interesting. But what is more important is the solid foundation and the solid scientific base on which you make this. That is why people are liking you and people are liking what you do. And this was a testimony to it. So thank you so much, Dr. Ravi, and we look forward to many more such interactions in the future. So Sandeep, every time he's in Pune, you have to get him to Sancheti. On that promise, big round of applause for Dr. Ravi. Standing applause. He deserves a big standing applause. Thank you very much. Thank you, everybody. The program is over.